You've tried everything for your L4, L5 disc bulge, L5S1 disc bulge, sciatica, leg pain, low back pain, buttock pain, spinal degeneration, bad posture, but no one's really taken full spine x-rays to assess the alignment of your entire spine and see how it affects your lower back. Watch how I mark this x-ray in a moment. It's full spine series. I'm going to mark it, and then you'll see the final outcome, and you'll see why a bad alignment of your entire spine can affect the lower back and cause damage to discs and the related symptoms to disc bulges, herniations, which is low back pain and leg pain. Follow along as I mark this entire x-ray. And that's how I mark all my x-rays inside my office. For those of you who have never met me, my name is Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada, just north of Toronto. And I'm advanced certified in chiropractic biophysics. And we work with patients that have these types of spinal distortions. The green line is where normal should be for normal spinal alignment from the side view. The red line is the patient, and you can see that is just not normal. And this contributes to a tremendous amount of spinal degeneration, including spinal arthritis, disc bulge, disc herniation, especially in the lower lumbar spine, also in the neck region, and that can cause all sorts of back pains and sciatica pains and numbness and tingling into the legs and weakness. So we help work with patients like this, where we help correct and bring the red line's bad spinal alignment closer to the green line. Now, if you subscribe to my channel, follow me along, because the next series of x-rays, I'm going to show you more and more how I mark these x-rays related to how we actually correct these spinal alignment problems with the techniques we use, which is chiropractic biophysics techniques. And I can tell you we've helped hundreds and hundreds of patients in our office resolve their disc bulge injuries, L405, L5S1, sciatica-related pains related to the disc injuries, neck problems, cervical kyphosis, military neck, thoracic hyperkyphosis, using non-surgical techniques, using chiropractic biophysics techniques. And this is even without spinal decompression. And a majority of our patients, 90% plus, have done really well and gone back to their normal quality of life. So stick around on my channel, subscribe, because I will show you how we apply these correct techniques. I'll actually demonstrate them on myself, and I'll actually show you how we go ahead and start correcting this particular spinal misalignment that's causing a tremendous amount of damage to the spine, to the discs, and giving a poor quality of life and poor quality of health to this patient and all the patients that come in like this. The last thing I want to say is that if you have never had a full spine x-ray analysis like this, then you need to find a corrective care chiropractor that does this kind of analysis. And even if you had MRIs, CAT scans, all sorts of other x-rays, maybe even had just a low back x-ray, well, that doesn't give you the full picture. And I'll talk a lot about that inside this next few videos that I'm going to show you. You need to have a full spine analysis like this. You get a full spine picture of what's causing the low back issues and the disc bulge issues, and you get full spine corrections with corrective care chiropractor like myself. So follow along, subscribe to my channel, because I will describe and demonstrate how we correct this and how we get the results we get with our patients. And hopefully you can find someone that does the same work as well. And go ahead and watch this next video up here to see some of the demonstrations that we do with lumbar traction to help correct. In that case of this video here is a straightening of the lumbar spine, but the concept is the same, applying non-surgical corrective care techniques to help restore spinal alignment and improve the back pain and leg pain symptoms associated with disc bulges, disc injuries, and sciatica.